Hi everyone, this is Dr. Garima Verma, your very own Dr. Scrubs, and today we have with us my senior from UG days, Dr. Panya Kapoor, who is currently pursuing MD Anaesthesia from IGMC Shimla. So, welcome, ma'am. Thank you for doing it with us and for doing it for us basically. So, how are you?
I am very well in such a good place, Shimla. So, and what about you? How are you?
I am fine, ma'am. बस scorching heat में तप रहे हैं. You're तो sitting in Shimla. शिमला का
I
तो weather बहुत
am
अच्छा है.
like good environment at least.
हाँ मैम, ये है. Thank you मैम, and just tell a little bit about your life, like how is life and how is residency treating you?
Life is pretty good, yeah. Actually, I am lucky enough to be staying in the same city after UG with my parents. My parents are also residing in Shimla. So
Okay.
everything that goes in the residency in the hospital is eventually turning out to be good because जब आप parents के साथ रहते हो तो bad also turns to good.
You
So
get to
life is
come back home, basically.
and everything is good till now. Baki residency to me is treating us like a newborn. I
Okay.
can talk about anesthesia residents. So in the first year, especially in this department, they are treating us like newborns. They are learning us how to be reborn in the medical field, I would say. And a lot of teachings, a lot of care, a lot of scoldings also. So residency also is going good.
So, ma'am, what does a day in your life look like? Like, what is the work that you do in the hospital, and when do you get free and everything?
Okay, so my day starts at 7 in the morning. I wake up at 7 and we have to reach the OTs by 8:30.
Okay.
I'm talking about elective OTs. So there
Okay.
are like 10 OTs functional in IGMC,
Hmm.
8 elective OTs and 2 emergency OTs. So 9:30 to 4 we are in elective OT. And we are running the OTs in rotations. Like one
Okay.
month I'll be posted for surgery OT, one month for ortho, and so on.
Okay.
So 8:30 we go. 8:30 to 9:30 we have to prepare the OT, everything, drugs, preparations, check our patients again, and then by 3:30 or 4 the elective OT is over, and then we have to go for pre-anesthesia checkups. Then these PSCs are informed to consultants, and we come back home by like 6 or 7 in the evening,
Okay.
and then there's no going back to the hospital on elective days.
Okay.
Talking emergency OT and ICUs, they work in two shifts, morning
Okay.
and evening. So 12-hour shift. ICUs we do naturally we are trained in critical care in the ICU, and we have to go for, like, we get peripheral calls from various departments for intubations, for central line insertions, for other procedures like LPs and all. And emergency OTs though is like uh, walking on toes. Even ICU is like you can't sleep. There's constant alarm ringing in your head. So after first month of posting in ICU, even you get ICU psychosis. So, but it's a good feeling. A lot of ADR rush, and then we are posted in KNH also for gynae postings, and that's it. Anesthesia.
So basically, in emergency and in ICU, you have to be on your toes, but elective, may you get some time for yourself.
I would say elective may we get ample time for
Okay.
ourselves. uh, in a theory of relativity, compared to other branches, you take your bag, you go say bye to them, and they are like, "यार अभी तो हमें ये काम है, ये काम है." Then you feel good, यार, you're going.
Okay, ma'am. So why did you choose this branch and the college that you are studying in?
Okay, so first thing, I had one thing very clear in my mind. I cannot compromise on my work and professional life balance. So I always wanted a branch which will give me time for myself, to my
Okay.
family. So I had only two options in my mind. One was anesthesia and one was ophthalmology.
Okay.
Because also you
Yeah, yeah, yeah.
have
Optha is a very good
limited,
branch.
it's a very beautiful branch, and so is anesthesia.
Yeah.
So I definitely wanted these two branches to be
Okay.
my identity future. And talking about the college, I came through a GDO category, like in service. So my parents are in Himachal only, and I am also in a bond period of 4 years. So I always wanted that I should pursue my college, my residency in Himachal only. So IGMC is a good option.
Yeah.
So
IGMC is a top-notch
anesthesia,
institute, na? Like people from
IGM,
all over the India, yeah, they are coming to IGMC.
branch like anesthesia, it comes in national ranking also.
Yes, ma'am.
So it was a good win-win situation for me.
Correct, correct. So you already told that you have an alternative of optha in your mind. Any other thing that you considered कि नहीं कुछ और भी ले सकते हैं?
Yeah, other branches like medicine, pediatrics, or surgery, they're very interesting. But to my personal opinion, I can't be working 48 hours non-stop in the hospital.
Correct, correct. Like some people want time for themselves.
Yes, time for themselves, for their family also, and
Correct.
you ought to discover yourself also,
Correct,
na?
correct.
So I wanted balance of everything, for enjoyment also, for studying also, for this thing
Correct,
also.
ma'am. So, ma'am, are you happy with the choice that you made? And if
Definitely.
and if given an option to change the branch, would you do that?
No, I won't.
Your first priority was anesthesia, so you
No,
are
because also, na, it was a win-win situation for me. So if given a choice, also I won't go for a change.
cool. So, ma'am, how is the transition from MBBS to MD? Like MBBS level पे तो हमें बहुत कम exposure होता है anesthesia का. Like हाँ, anesthesia का we have a very minimal exposure during our UG days ना. So like मुझसे पूछो तो I don't know anything about anesthesia. Like everything तो it's very difficult.
Yeah, matlab, you are partly correct in some things, because in MBBS you are just exposed to, I'm talking about my branch, you are just exposed to anesthesia for like 15 days
yeah.
maximum.
Yeah.
And that also, you just go, you sign your logbooks, you
And
get
you
your
come
logbooks
back.
signed. But anesthesia is a real time medicine, I would say.
Correct.
Matlab, I would give you an example. Like if you are treating a hypertensive patient, if a medicine person is treating a hypertensive patient, you put him on medications and you just follow up him after 2 or 3 months. But on the OT table, you see the BP shooting of a patient like 220 or 220, 139. You just give one drug and you see the effect in like couple of seconds. So you get that something is running in the body in front of your eyes, just effect. Plus, you get the ADR rush, a lot of ADR rush in anesthesia. So, you, when you come into the branch, you discover other aspects which you were like totally unaware in MBBS. You just see कि क्या करते हैं, बेहोश करते हैं, उठा देते हैं बेहोशी से, बस इतना ही है. But not that. ICUs, मतलब you even in my setup, we have seen patients who are lying in ICUs like for 3 months, 3.5 months, and they have gone back. They have come back also. So that is also very good feeling. Yeah, every day you talk to a patient who is not even responding to you, and after 3 months you see things improving, and just that gives you a very that gives you the utmost satisfaction of your life.
Correct, ma'am. Correct.
So, and the branch is also very beautiful.
So you're totally in love with the anesthesia part of medicine.
I am in love with anesthesia, you can say.
Yeah, ma'am.
I am in.
Yeah. So, ma'am, are your parents doctors or not?
No, my parents are not
how
doctors.
did you convince your parents that I want anesthesia? Like my parents are not doctors, and for them anesthesia is like यार ये तो बेहोशी के डॉक्टर हैं, तू क्या करेगी anesthesia लेके?
Yeah, that is when you have to convince a layman for something, na, those who are not related to it in like
it's
a
very
smallest bit.
difficult to convince them. It's very difficult to tell them what an anesthetist does basically. It's not about just behosh karna.
Exactly. It is not just about behoshi. It is like you're continuously maintaining the patient so that the surgeon can work on it.
Exactly.
Well, a surgeon is doing a beautiful, wonderful job, but you are just maintaining things for him.
Correct.
So that him and the patient also. Okay. hemodynamic stability does not limit to BP and
Correct,
heart rate. It is way more than that.
correct, correct,
Okay, you
correct.
make the procedure. मतलब, the patient should not even remember the slightest of the portion what happened to him in the hospital,
Correct,
in
ma'am.
the
Correct.
on the OT. So yeah, I just sat with my father and I said, "सुनो, क्या होता है anesthesia में?" And we talked for like 2 to 3 hours. But my parents have always been supportive from like class nursery to 12th to MBBS. They have supported my decision blindly. If I would say I would go for not even pursuing any residency, they would be happy that way also. So
Correct.
it was not to convince my parents. They were to rather jumping कि यार बहुत MD बढ़िया है.
Correct, ma'am. Correct. Like if I talk about myself, so my father is like, एंड में उनका बिल्कुल एकदम स्टेटमेंट नहीं होता है, यार ले ले जो तुझे लेना हो, हम खुश हैं.
But that is the beautiful thing about parents ना यार, जो आपकी खुशी है वो उनकी
हाँ,
खुशी है.
कहते तू ले ले जो तेरा मन करे वो ले ले, हम तो खुश हैं,
हाँ,
जो मन करे वो ले ले, तूने लेना है. They are basic like this. You have to do it. Just don't turn back. Just don't look back and complain.
exactly. And now the situation is कि when other people, those who are not well versed with the branch, they come and ask my father कि what exactly does your daughter
Correct.
do? Then he said, "You know, बैठो."
Let me tell you.
You
Correct, ma'am. Correct. So, ma'am, do you get some time for yourself, especially in first year of residency? And is there any toxicity in your department?
Yeah, I do get time for myself. It is like we have many PGs
Okay.
here. We are like 17 PGs in each year. So
Okay.
we have approximately 50
Hmm.
plus PG. I'm very poor at maths. So I get time for myself. We get off on guested holidays on Sundays,
Okay.
except for emergency
Emergencies. Correct.
ICU and KNH duties. If you're posted in KNH for Sunday, you have to go. Otherwise, I get time for myself. I get time for studying. I get time to party. I get time to roam around on Mall Road.
The
I
best
get
part
time.
is to roam around on Mall Road.
Malling is a different feeling.
बिल्कुल बिल्कुल exactly. I completely agree with you. I am in love with Shimla.
But Shimla, initially when you enter Shimla, na, you say कि यार कितना चलना पड़ता है.
हाँ,
But eventually fall in love with the place. यार. Every
बिल्कुल.
day I take a walk to my hospital now. It's a scenic beauty to watch. 20 minutes
Also,
I'm going through.
also मैम हेल्थ भी तो ठीक रहती है.
हेल्थ भी ठीक रहती है यार, बहुत बढ़िया रहती है.
मैम
And
मुझे तो
talking about opportunity that you asked, na, मतलब I would rather say some people confuse strictness and discipline for toxicity. That is
no,
not
that is not
toxicity.
toxicity.
That is not toxicity. So my department in this hospital is not at all toxic, not even a bit. Starting from SRs to my seniors, immediate seniors, third years, my SRs, my consultants, nobody will scold you for anything wrong that even you do. They'll just make you realize that this is not
Okay.
going to work this way, will work this way. But yes, there is strictness in the department. There are rules that you have to follow, and there is discipline in the department, but which cannot be confused for toxicity.
Toxicity, correct. Like मैम anesthesia में what I have heard from people is कि anesthesia वाले अपने residents को बहुत संभाल के रखते हैं. They teach them like spoon feed करते हैं.
This is the truth.
This is the truth.
And वाले अपने residents को truly संभाल के रखते हैं because they care for your 3 meal course.
Yeah, yeah. Like nobody else does. मतलब there are other
But
departments when you'll be eating, they'll call you and they'll tell you कि come back. This is the work.
yeah, this is the one. And moreover, yeah, they give time to you for every. For breakfast, they'll send you. For lunch, they'll send you to the canteen. And even if the OTs are running beyond 7, they'll order dinner for you also. So, sweetest thing I like about
Then
the branch.
you get their meal 3 times a day.
3 times a day and chai breaks in between.
Wow.
So, like heavenly feeling to watch other people in the OT and you are going for chai
Chai
thrice
break.
a day, not even having even a sip of water.
Correct, ma'am. So, ma'am, any specific tips you want to give to somebody who's waiting for counseling and anything?
Yeah, counseling. Those who are waiting for counseling, I would say 3 points. First, fill your options very wisely.
Correct.
Second, read the prospectus, each and every line, very, very, very carefully,
Correct.
because those lines are very confusing. You have to take out the meaning from every line, what they
Correct,
want to
ma'am.
say. Third, to my personal opinion, I would suggest go for branch rather than college, because
Okay.
college will be a part of your life for 3 years.
Correct, but
Okay,
branch will
but
stay.
be with you till you die. You'll be identified by your branch in this profession.
Correct, ma'am.
So you go for your branch, even it is any branch you want to do from the 19 subjects. You
Correct,
should
ma'am.
definitely choose.
So, ma'am, there is so much fuss about MD versus DNB. So, if somebody is getting DNB at a very good institute, so should somebody prefer that?
Yeah, that's a personal opinion, I would say,
Okay.
because as medicos we know that there's no difference, because
Correct.
NMC has also
Yeah,
justified that
there is no
again
difference.
DN totally parallel degrees. Okay, but to some people DNB is still at a lower level,
Okay.
but which is not true. Which is
Correct.
not true.
Correct.
Plus, you have to consider many things in DNB. Our DNB exit exams are tough in
Correct.
many of the situations, many of the institutes. The passing rates are very not very high, and MD people always have an edge in their
Passing
exams.
at
Yeah,
least. Huh.
because you have internals along with you. In DNB, you can't predict where, in which state you'll be giving your exam,
Correct.
who will be your exam. You can have language barriers. You can face so many problems. So, though DNB, you have to work like very hard,
Yeah.
but after DNB exit exams, you'll be like तराश के निकलते हैं DNB के बाद भी ऐसा नहीं है.
Correct.
So to my DNB and MD are hand in hand. There's no
It does not
difference.
matter. If the institute is good, if the residents'
हाँ,
passing rate is good, then somebody should consider it.
for surgical branches, you should consider how much cutting they
Correct,
will give
correct,
you,
correct.
how much exposure they will give you. Same goes for non-surgical branches also.
Correct.
So there are many aspects, and that's a personal opinion what one has to follow.
Okay, ma'am. And ma'am, what was your mindset before joining residency? Any preparation required?
Yeah, my mindset before joining residency was ki I will be open to everything, good or bad, that comes my way,
Correct,
accepting it with warm hands, nothing like that.
correct,
And I'll be doing my work sincerely, particularly me. Anything assigned to me will be completed no matter
correct,
what. If I'm doing it by 5 or I'm doing it by 11.
correct, correct. This should be the mindset. Then things will get easier. Like वो ऐसा नहीं लगेगा कि burden है.
Yes. And be regular. जो आपको काम आज दिया है वो आज ही
आज ही
होना
होता
चाहिए.
है. Correct,
Don't pile.
correct,
Because in the end, it is not for me, it is not for you, it is only for the patient in every branch.
correct, ma'am. Correct. Exactly, I agree. Last question, ma'am. It's a fun question. When you were preparing for NEET, who was your favorite faculty and what was the source that you used?
Okay, my source for preparation was DAMS,
Okay.
and my favorite faculty was, I would say, Dr. Tushar Mehta,
Okay,
orthopedics. He
OPD, next patient, please.
OPD next patient, please, exactly. So, three reasons to love him. One, he's very cute.
Correct,
Two, he's full of optimism.
correct,
And three, he is like work hard and party harder kind
correct,
of person. So
correct,
I relate to him the most.
correct,
I
ma'am,
think
correct.
all these things I also feel the same.
He's the most energetic teacher that I have seen, I have met, or I have talked to.
मतलब I to have attended his live class at Chandigarh. So 2 days we used to sit from 9 to
9 to 9.
10 p.m. The days were like makhan ki tarah smooth.
Correct, ma'am, correct. So his classes
It
were
was,
always fun.
yeah, totally fun. And what he used to teach in the class would, I think, I can teach orthopedics very easily.
From
Even
his notes.
but I can teach some things very good.
So, Dr. Tushar Mehta for the win.
For the win.
Correct, ma'am. So thank you so much, ma'am, for taking out time for us and doing it. And I'm very grateful that you agreed to it because I feel residents are very busy. I've been talking to so many now, and they are legit very busy. And somebody giving me time to do this is I really appreciate it. Thank you so much for it.
No, Garima, you are one of my favorite juniors, so there was
That to ma'am you have to say now on this video.
that was always a yes, yes for you.
Thank you so much, ma'am. Thank you so much.
For having me. It was a great pleasure to be with you, and all the best for your doctor scrubs.
Thank you, ma'am. Thank you so much, ma'am. I'll catch you up on WhatsApp. Thank you.
Sure. Thank you.